Welcome to our Geriatric Addictions Rounds Holiday Special. Our collaborators for Geriatric Addiction Rounds are Baycrest, Behavioral Supports Ontario, CAMH, Canadian Mental Health Association of Waterloo Wellington, and St. Joseph's Health Centre Foundation in Guelph. So for our next 12 days, we will post a short video presentation of a live mocktail lesson or no alcohol-based beverage prepared by leaders in healthcare advocacy and community advocates. So they will provide us with a recipe with a no alcohol-based seasonal beverage, tips on how to be a good host over the holidays, links to resources on alcohol and brain health, and key messages on making healthy choices. So our moderators today are myself. I'm the geriatric addiction specialist at Baycrest, a co-chair of the Canadian Coalition for Seniors Mental Health Guidelines on alcohol use disorders among older adults, and the provincial lead for Older Adult Substance Use Collaborative in Ontario. Dr. Alexander Caudarella, welcome. He's the CEO of the Canadian Centre on Substance Use and Addiction, CCSA, and the CCSA lead the initiative on Canada's guidance on alcohol and health. And there's a link here. I'd like you to click on that when you are viewing this, so you can see some of the resources. So our purpose behind the 12 days of Merry Moderation is to increase the awareness to the alternatives to alcohol, and looking at want to increase the awareness of Canada's health guidance on alcohol from the CCSA, and help Canadians understand the benefits of making healthy choices, including healthy brains, healthy bodies, and prevention of alcohol-related dementia, and help Canadians be responsible hosts over the holidays and ensure that their guests are not at risk of drinking and driving. So I'm going to turn it over to you, Dr. Caudarella, to talk about Canada's guidance on alcohol and health.
So previously, these were known as Canada's low-risk drinking guidelines. And a lot has changed in the past 10 years since CCSA did those low-risk drinking guidelines. One of the things that has become a lot clear is just how impactful alcohol can be on your health. And this has really manifested itself by our understanding that alcohol is linked, unfortunately, to at least 7 different types of cancer. But we've also understood how it interplays with a lot of different medical conditions that maybe we didn't understand as much even 10 years ago. What I really like about the guidance here, and what I find really exciting, especially around the holidays, is I think that a lot of people are feeling stressed, and maybe the world's feeling a little uncertain. A lot of people are looking for ways they can make their health better, and even small reductions in your alcohol use can make a dramatic impact on your health. If we go through the continuum of risk here, now this might seem a little overwhelming. This is the number of drinks per week you have. One of the things that's changed a little bit is there isn't a line in the sand anymore. There's not a guaranteed amount of alcohol that we can tell you can have and have no consequences related to your health. A lot of that has come from the advancements in science that we've seen and our better understanding. Now, that doesn't necessarily mean that everybody who drinks alcohol is going to have problems with it. And as you can see, more than the 2 drinks per week gives you the 1 in 1,000 risk of an early death, and the 1 in 100 risk happens at more than 6 drinks per week. And then after that, it increases. What's really interesting is actually the more you drink, the more reducing even 1 drink can have a positive benefit on your health. That's because the risk increases exponentially. So when you look at this, I hope that you can see and understand that you can set yourself a target or a goal depending on your understanding of the different health risks that are there. You can try and make even small reductions and probably see pretty significant health benefits from that too. Some of them are short-term in terms of better sleep or a little less anxiety, and others are long-term, like less likelihood of developing, again, those 7 types of cancer, including colon and breast cancer, which are ones that people spend a lot of time thinking about. The other part that's really important, especially when we deal with older adults, is We may not be understanding how much even small amounts of alcohol might be impacting our memory, the way we think, the way our medications interact with us, and even the way medications or those health conditions interacted with alcohol 10 years ago might interact very differently as your body ages and your brain ages. So we encourage you to use both the holidays and the January and the coming months to kind of explore that relationship. Talk to your family, talk to your loved ones, look at yourself. And if people want to come and spend time in the holidays with you and reduce their alcohol use, try and create an environment that helps them do that in a festive and happy way. We also need to think this holiday season on how alcohol might affect different populations. In particular, anybody who's pregnant or thinking about getting pregnant, no alcohol is the right answer. And if you're breastfeeding, it's best to avoid alcohol. In addition, you might have members of your family who've had problems with alcohol in the past, or even people who are trying to reduce or limit their amount. So have conversations with them. Doesn't mean necessarily not drinking around them, but it probably means understanding will help them feel comfortable and creating that space.